Hi, and welcome to episode 143 of the Untethered podcast. Today we have Cassandra Thompson joining us. Cassandra is an advocate spreading awareness of and supporting others as they navigate oral restrictions, tongue, lip, and buccal ties. After experiencing dismissive medical professionals, significant misinformation, and a lack of proper support with her infant daughter, she launched the Unbound Network, a community focused on informing, connecting, supporting, and sharing experiences. Using her multifaceted design background, she has started the Unbound Network on Instagram, where she engages through visual storytelling. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie Balkin. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. Cassandra, thank you so much for joining me today. I'm excited to have you on the podcast and learn all about your journey.
Thank you. I'm very honored that you asked me to be here and to share our story.
Yeah, as a parent who's been through this, I think that having the perspective of the parents for both one, other parents to hear about, and two, professionals to hear about. I know a lot of us professionals work with parents day in and day out, but we don't always get to hear, and maybe we do, but we don't always get to hear that raw, unedited version and experience of what it's like on this level for a parent and baby, that infant mother dyad to go through the tethered oral tissue, airway, feeding, all of the above myo journey that I know you've experienced with your own daughter. So I'm going to turn it over to you and let you share with us, if you will, your journey, which I know you share on Instagram. People can follow you at the Unbound Network, but, tell us, how did this unravel for you as a mom and infant, feeding dyad?
Yeah. So I am mom to Mari, who is a wonderfully rambunctious, now 19-month-old. We have had so far quite a journey, and I think like a lot of experiences, it has been sort of an ongoing process, and I think it will continue a bit. But Mari was born at the almost very beginning of the pandemic, and pretty early on, we had feeding challenges. I didn't know necessarily that they were feeding challenges at the time, but I experienced significant pain. We had a very scary weight loss scenario happen very early on in her life, around day, let's say day 3 to 4. Low supply struggles, open mouth posture struggles, snoring, sleeping struggles with Mari, colic, excessive gas, so many issues, including severe ongoing tension. And, ultimately we learned, I, sort of pushed for figuring out what was going on. And we learned around 7 weeks that Mari had a severe posterior tongue tie, that she had a significant upper lip tie, and also that she had upper buccal, upper cheek ties. And it was a long journey to get to the point where we found professionals who not only understood ties truly and the impact and how all of the symptoms and struggles we had been experiencing were linked, but also really a team to help support us through the process. It was quite a long couple of months. So that journey really sort of brought with it a lot of unexpected struggles for us, especially I'd say for me as a first time mom and for my husband as a first time, dad. And it brought also a lot of unnecessary suffering for our baby. And so I started the Unbound Network, I think, really just in response to me feeling frustrated, frankly, that not only did we struggle through this because of the lack of knowledge in the medical, professionals that we were relying on, but really because I saw so many other families struggling in the same exact ways. And that's sort of where we are today.
Yeah, I mean, a big passion is born out of not wanting other moms and babies and, family units to go through what a lot of
Yeah.
us have been through. And, I know as a mom who experienced it, we had a lot of the same with my first daughter, a lot of the same symptoms that you mentioned. She lost too much weight in the hospital. We had to start the weight checks immediately. Like the next day, we go home from the hospital. The next day, I'm like now trying to get out of bed with my baby to like go to the pediatrician for like daily weight checks. And
Hmm.
it takes a toll. Like you're like, I'm trying to heal and I'm just trying to feed my baby. And here we are, like with all these extra things that we need to do. And in the thick of it, really, I know that the intention was good, but it wasn't helpful. It was
Hmm.
anything more harmful because of the additional stress it put on me. I opened up my pediatrician's app and it said my child had failure to thrive, but nobody had ever mentioned those words to me. So I'm reading it on my screen for the first time. And it's just like puts a wrench in your mom heart where you're like, just stick a knife in me and turn it 5 times. Like failure to
Hmm.
thrive, I'm doing everything I know I can possibly do to just keep this baby thriving. And she's failing.
Hmm.
I'm failing. Right. And,
Hmm.
as a mother, like carrying that weight in addition to all of the postpartum hormones. And, it's like we're in fourth trimester now and there,
Yep.
there's no support. I mean, sure, the pediatrician was great because they asked me questions about me. And I know not all pediatricians do that. They were definitely monitoring me for like PPA, PPD, just through all of my infant, the child's well checks throughout the first year of life, which I
Hmm.
appreciated. And I didn't seem to present with that, but also my internal struggle with not being able to feed my
Hmm.
child when you feel like I have like two responsibilities with this child, right? Is like basically to keep them alive. And we do that by keeping them fed and, and clean and, sleep
Hmm.
hygiene is important. And yeah, it just was like, I just need to feed this baby and love on this baby. And I'm failing at 50% right now. Like, and it's hard to love on a baby when you feel like you're failing too. So
Yeah.
yeah, it's such an impact that I don't want to say nobody's talking about it, but it's not readily available information if
It's
parents
not.
don't know where to look, even in this day and age with, Facebook groups. I know people jump into Facebook groups and they ask questions, and on those threads, the divide, even in a tongue tie group of the information that you get for and against and this and that. And I'm going like, this is like maybe more harmful than it is helpful at this.
It can be.
Who do you know?
Yeah.
Who do you trust? Who do you listen to? How do you even navigate what you're supposed to do next as a parent? I mean, I know professionals in this space who have teams at their fingertips who are like, I don't even know what to do for my own child, and
Hmm.
there's definitely this underlying issue of like, who do you trust? And I know you and I were chatting
Hmm.
before we hit record, and that was a big question of yours as well. So, and I know we've had some parallel journeys just in that pediatricians, like let's go there, because I know pediatricians, for example, while they're wonderful and they've gone through a lot of schooling and we're not discounting their knowledge, for me to have a pediatrician rule out a tongue tie without doing a functional evaluation and just,
Hmm.
oh well, they're gaining weight, they're on their own weight curve, or they can stick their tongue out, which is what we hear frequently from the babies
Yeah.
that we treat, that those are not indicators of whether or not a tongue tie is present. Like, let's just throw that out there first and foremost. But it,
Mhm.
it drives me batty as a mom and a practitioner that they're dismissive of potentially one of the biggest issues causing those feeding challenges right now that everything else is like trickling down from. And if we could address this
Mhm.
properly, we could save a lot of time, energy, tears, anxiety, depression,
Mhm.
potentially for the mother,
Mhm.
that infant mother dyad. But anyways, I know you've gone through this. So what was your experience like, going to the pediatrician? Do you feel like they were supportive? Do you feel like they were dismissive? What was that like for you?
Yeah, so so I'll say um I I approached my pediatrician after um a very long late night kind of rabbit hole research process. And Mari would have been about 5.5, maybe 6 weeks old. I'll say 5 weeks when this happened. And I've shared that I actually happened to come across a random mom's blog. Um, I was researching initially why I had low supply, because up until that point, the only thing that I quote unquote knew was that the struggles we were having, why Mari was refusing to nurse, why she was pushing off the breast when she was nursing, why we had struggles with positioning, and why she had, a preference for one breast versus the other, and why she had, lost so much weight, and why we had to supplement formula. We knew, quote unquote, at that time that all of it related to the fact that my body was not producing enough. And that was a very heavy thing for me as somebody who um, struggled to get to the point of having a healthy pregnancy and a healthy baby. Just wanting to be able to provide for my baby was such an important thing for me. And there's nothing wrong with, families or parents who choose to not nurse, not breastfeed, chest feed. But for me, that's what I wanted. I wanted to be able to do that.
Yeah.
So I was researching, why do I have low supply, trying to figure this out, and came across a mom's blog. And I remember just like crying as I was reading this, because I was like, she gets it. This woman, this random woman from another part of the country, it was like a 3 or 4 year old blog. Like it wasn't even a new thing. I don't even remember how I came across it, but she understood. And so I then, just from reading her blog and her account of what she struggled with, I then sort of started understanding what was going on. It also linked to a conversation that I had with a friend who also had struggles, and all these things kind of swirled together. And I was like, oh, well, like, what causes low supply? Or, why do some babies have high palates? Or, it was just sort of like this mix of research, if you will. And I eventually got to the point where I was like, oh, what's a lip tie? Oh, that's interesting. Wait, that's what Mari's lip looks like. Is it not supposed to look like that? And so I eventually just landed on this oh, Mari has a lip tie. That's what's causing the issues. That must be why we've struggled. And I'm going to find the right resources for this. So I happen to have a client who is a dentist. She's not a pediatric dentist, but she's a dentist. And I reached out to her and I was like, do you have any information about this? Like, do you know anything about ties in general? And she shared that she didn't, but she had a friend who does. And she connected, and I sent some photos, and her friend was like, yeah, like it does look like she's got a tie going on. Like, contact your pediatrician. So I did, thinking like I've cracked the case. No questions are, remaining. You're welcome. Let's work on the next steps.
For you.
And yeah, ta-da, right? So yeah, exactly. So I sent a photo, and I explained what I had found and the research and the contacts that I had made and all of this. And I was like, they referred me to this specific hospital, can you back up this information? And that chat came back with basically, um, you know, ties are a fad, and it's unlikely that the feeding struggles you and Mari are having are related to them. And I'll refer you to an ENT just to see what they say. But let's continue on with the course of action. And I was like a little devastated because I really just in my gut felt like, but I really think that this is what's going on. And so I was referred to an ENT. That was a terrible experience. And, further put me in this space of confusion and concern and not really knowing what to do or who to go to anymore. And, also when you're a first time parent, being told that you're just nervous because you're a first time parent, or you're just, looking into things that aren't really there because you're a first time parent, especially as somebody going through, as you mentioned, that fourth trimester. That's a lot to process, and you begin to question a lot of things, including just like, for me at least, like my own thought process, my own instincts. And that is something that I've always really prided myself on having good instincts.
Yeah.
And
Instincts.
I just felt and was made to feel like a little crazy, actually, like that I was just being, that I was just overdoing it. And in the back of my head, I was just like, but my baby is struggling and I'm struggling.
Yeah.
And is there anybody who really can own this process of figuring out why we're struggling? And at the time, I didn't even really know, frankly, how much we were both struggling, because everything that I was experiencing was just chalked up to being normal, right? Like, it's normal that we would battle thrush for 8 weeks. It's normal that I would have cracked and bleeding nipples because, they just have to toughen up. It's my first time nursing, and
like it should hurt in the beginning. Like, what?
right, right. I know now that that's not true, but in the beginning,
about all the labels they give babies, right? Oh, they're just a lazy feeder. Oh, they're just
lazy feeder.
Oh,
Yep.
no, babies are not lazy. Let's stop calling them these names. Like, no, babies have a job. Their job is survival, and they have to do that.
Yes.
Feeding. So if they can't, we need to look at like what is going on. They are not choosing volitionally
yes.
to feed. That, I'm sorry,
Yes.
but like, let's just get rid of that. And the whole colic thing, I'm like, this is a hill I will die on. Colic is a symptom. It is not a diagnosis. So when we have these pediatricians saying, oh, your baby's just colicky, or oh, they have reflux, let me put you on some medications. And I'm like, oh, like, why have we not tried behavioral interventions beyond just like maybe, and I'm not going to throw IBCLCs under the bus, but I went to one who never looked in the baby's mouth, who basically told me I was holding the baby all wrong, who, and I'm like, so there's, and then also there's feeding therapists out there that are not experienced in this either. So I think it's really tricky because we hear these things, we get referred to these professionals who are supposed to be the professional for this issue. And sometimes they don't even have the training, right? I know with my second child, the IBCLC that I went to with the first, like she had gone on to get additional training, which I really commend her for, because now she was looking at things through a different lens, right? And so while with my first, I didn't go to her for my second, but I knew that she was working in my pediatrician's practice and was now looking at things very differently, which is great. But how do we gauge that? Like, how do we gauge the level of knowledge? And I know I just went on like 5 different tangents, but it's like back here. But, going back to like these terms that we give babies, oh, do you have an easy baby? What? Like, define an easy baby versus a challenging or hard baby. No, it's just a baby. It is a baby. And the whole concept of like, oh, it's just a little tie or just a mild tie. We don't need to do about it, or like, what? No, I'm sorry, either we have a tie or we don't. This whole like level of scaling the tie from mild to severe, it's irrelevant how mild or severe it is in appearance. It depends on how much it's impacting the functional ability of this baby to survive and feed and breathe and sleep and anyway. So I know I could go on a much longer tangent on all of these things, but I know that you've had posts on these things too, just like I have. I was like, we have got to have you on this podcast because I get it as a mom. You're doing such great advocacy out there for other moms to connect with you. And it drives me crazy when I hear, are there medical things that can cause low supply for a mother? Yes, absolutely. But most of the moms that I hear say, oh, I was just told it's my supply. I'm going, did anybody look in your baby's mouth? And they're like,
Mhm.
oh, why? Why would they do that? I'm like, maybe your baby's not demanding enough milk. Maybe your baby's
Yeah.
fatigued too quickly because they can't pull the milk. Maybe they only get to a certain point and that's why they need to frequently feed, but that's also teaching your body how and when to produce milk, and it's not efficient and it's not
Mhm.
a you issue. Like, again, not discounting that there are reasons why mothers maybe have a low supply. But a lot of the babies we see, it's not a mom supply issue.
Right.
It's
Yeah.
baby.
Yeah. I think it's really so important to acknowledge and go back to the terms that you noted,
Mhm.
and even like more broadly, perhaps like phrases. Like
Yeah.
if a baby is colicky, it's because they're uncomfortable.
Yeah.
Something's wrong. They're communicating, right? It takes energy to cry and way more energy for babies to cry for hours in a day. So that, and I remember having like this aha moment at some point thinking like, but wait a minute, it actually takes energy to cry.
Right.
So couldn't it be that Mari is crying because that's how she communicates and she's communicating that something is wrong?
Yeah.
So like I really reject the term colicky baby.
Yeah.
Colic is a thing, but it is a symptom.
Right.
It is not a diagnosis, right? Same thing with reflux. Like reflux is a symptom. If a baby is experiencing reflux, there's an underlying cause, there's a root cause for it. Are there scenarios where perhaps the reflux is so severe and significant that maybe a baby has to be put on medication?
Absolutely.
Maybe, sure, hopefully temporarily. But again, there's an underlying cause. And, you know, as you know, these scenarios are not always caused by ties,
Right.
but a lot of times they are. So to across the board dismiss, discount, cast aside is really detrimental to the health and comfort of families, not just infants, not just toddlers, adults as well, parents as well. Um, so when we use these terms, colicky baby, reflux baby, lazy feeder, Mari was given all of those titles. She
Yeah.
was a lazy feeder, and I remember also thinking like, well, evolutionarily that doesn't make sense
Yeah.
because like a baby's job,
Yeah.
right? Their instincts
Yeah.
tell them to survive.
Right.
Their instincts tell them to survive so much that they have the ability to crawl to
Right.
get to a nipple to feed right out of the birth canal.
Yeah.
So it didn't make sense to my brain at all that then somebody would suggest that she's just lazy. She's too lazy to eat. And actually when we met with the ENT, he quickly dismissed that Mari, the first ENT that we saw, I should say, so quickly dismissed that Mari had a tongue tie. There's no way that she had a tongue tie. But she did have a lip tie. But ties don't cause feeding issues. And I forgot where I was going with this.
Oh, well, about that, I'll share my ENT experience.
Oh yeah.
I mean, when I came back from my first myo course and I flipped Lily upside down and I was like, like I gotta look in this kid's mouth. And I saw that she had a lip and a tongue tie. And I was like, you've got to be freaking kidding me. Like, why didn't, like, we were going for weight checks. I saw an IBCLC. Like, so I take her to the ENT, the first one who's supposed to be the release provider, like ENT release provider in the area. And she's like, well, you're not breastfeeding anymore. She's 24 months old, so we don't need to release those ties. And I was like, stop the madness. And she, like, I've referred patients to her. She knew who I was. She knows what I do. And she knew that I had just taken a myo course and that, so here I'm like just trying to hold back the tears because I'm like, well, shoot, like the person who's supposed to get it in my area doesn't actually get it. Like mind blown, mind blown. I just like, where do I even go from here? Right. So then I take her to another ENT. This ENT is supposed to understand myo, doesn't necessarily release infants, but does do, tonsillectomy, adenoidectomy, understands airway. And I'm thinking like, he's got to get it, right? So I take her there. He sees her. We have a whole conversation about like myo study clubbing and like all the things. And like, yeah, this is the guy. And they have her hearing checked and like all the things. And he's like, yeah, and I wasn't really going actually to him for the release because I didn't think he was going to release a toddler at 24 months. I did not want to put her under general anesthesia. But he took a look at her size 3+ tonsils and his exact words were, I'm unimpressed. And I was like, you're unimpressed? Like, I didn't say that to him because I don't want to be rude, but I was like, I don't even know what you mean by that. You're unimpressed.
Yeah, what does that mean?
Okay, well, we have enlarged tonsils that are veiny looking, but his whole thing was, well, her mouth is usually closed at rest when awake. And, you're telling me that she doesn't get sick that frequently. So she's not like a chronic, like, case where she's getting sick all the time. So like, I don't think we really need to do anything about it. Like basically no course of action, 0, none, not like, hey, come back in 3 months. Let's just monitor them. Nothing like, hey, maybe, not that I want to put my kid on the antibiotic, but like, no, like even suggestion of that might be a possibility. No suggestion of let's do a scan to look at our adenoids. No suggestion of let's, what was my other one? Let's use like a nasal spray or something and see if that shrinks the tonsils. Nothing at all, which I know are all viable options from other ENTs that I've spoken with.
Mm-hmm.
And at this point, and I left there being like, well, that's the end of the road. Like there's nowhere further to go based on that conversation. I mean, okay, I've now been to 2 ENTs, one specifically for ties, one specifically for the airway, neither of which see an issue. And they're supposed to be the go-to people in my area. Like you have got to be freaking kidding me. I was pissed.
Mm-hmm.
Then I went to my oral surgeon who I had referred patients to myself, was starting to like develop this like, relationship with. And he was like, well, her lip, like, I'm not convinced that we need to address the lip right now. Like it's not impacting her rest posture. And he's like, but I definitely feel like we should address the tongue. And I was like, okay, I disagree about the lip, but you're the provider and that's not my call. That's out of scope for me to decide. I'm like,
Mm-hmm.
from an open cup at 24 months. She dumps it all over herself. She can't seem to figure out the oral motor pattern and she doesn't have any apraxia. She doesn't have other oral motor issues. She's actually was like my tight baby who actually hit milestones early, I think, because she's so tight that like she crawled up the stairs early, 6 months of age, independently crawling up the stairs, 7 months in age, backing down the stairs and off of furniture. Like I showed her once and boom, she had it, like how to get off the low couch that we had on our deck. And as soon as I showed her how to do that, like she had the motor pattern for crawling down an entire flight of stairs. That was like one little step basically compared to like an entire flight. And I was like, oh gosh, shoot, why did I show her that? Like time, like she was the kid at like Little Gym who was going independently up the rock wall, flipping herself around and scooting down on her butt, like down the other side. And people were like, how old is she? I was like, she's 9 months old. And they were like, what? I was like, I know. I like, she's sure, I don't know what to do with her. Like, what is going on? Well, I later learned she was so tight that it actually like, to some would say like, okay, it benefited her gross motor development and either kept her on track or even a little ahead of the curve. But everything else, like now she had a tight neck with feeding. She could hold her head up at birth. Not normal. She had a side preference with breastfeeding. Not normal. Like I was in pain. She was struggling. She was a frequent feeder on the breast for 45 minutes for every feed with maybe an hour break in between because she wasn't pulling enough and she was fatiguing, but she was then kind of just hanging on me because we did. And, and I would pump on one side while she fed on the other because she preferred the one side over the other. And, I wanted to create a stash for the freezer so I could go back to work. And it was like all the things. But like when I look back at this experience and that journey in the first year, and then to still be having these struggles when going to providers when she was 2 years old, and, finally to find the oral surgeon who did release her tongue, her constipation disappeared overnight. It was gone the next day. And I was like, what, like that, I mean, it's got to be related because this is something we've been struggling with like pretty hardcore since introducing solids. So, whoa. but yeah, you can't make those claims. And then to see, her evolve and how she changed. And even from a sensory processing standpoint, from the point that we had our tongue released, the point that she went into early expansion at age 4, about like halfway through her ALF appliance, she started trying new foods, and her tonsils shrunk. And I've been yelled at in professional groups for making that claim. And I'm like, here are the photos. Here are the dated images. Tell me that her tonsils during cold and flu season did not go from a 3+ to like a 1. Tell me that. Go ahead. Here's the pictures. The only thing that she still eats dairy and gluten, despite the fact that I would love her not to have as much as she does, knowing that she's got enlarged tissues. I'm like, while eating that stuff during cold and flu season, she's looking pretty dang good. Do we think maybe related and growing her palate and giving her the opportunity to properly nasal breathe, whereas she didn't have the opportunity before? Like, I don't know. I'm just going to throw those things out there, but don't try to make these claims,
Yeah, heaven forbid we think maybe there's a connection there.
Right. So and now there's actually research that's proving everything that I've claimed. And I'm like, I mean, and that's where you go back to, like you've talked about, following your instinct, following your gut, following your intuition. And I think I've always done that, but at the same time, I didn't always trust it. And, I'm not a dental provider. I don't move hard tissue for a living. I work in the soft tissue arena. So I can't make certain claims, right? And I can't even give advice on certain treatment plans because that's out of scope. I can't say your child needs an ELF, but I can say you should go to the dentist and have a consult to see if your child would benefit from expansion, because my child did. I can say like that. And to have that discounted by other professionals was just like, it's enough to get it like as a mom, but then to get it from like professional colleagues too is like a whole nother level. And I'm just like, we need to be supporting these children instead of being so dismissive. We should be asking, why are these things working? Or why isn't it working? And what is the root cause? Like you said, there is a root cause, and our medical industry is they're infamous for just slapping the Band-Aid on it. Slap a Band-Aid on. Here's a medication. Slap a Band-Aid on, try this. Slap a Band-Aid on, try that, instead of taking the time to send you to the right practitioners who can help you truly get down to the root cause. And we're seeing in so many of these babies that root cause is that tiny string under their tongue and their lip, maybe the buckles. It's like, why are we still so divisive? Why is there still why are we not helping these babies? Because if you're going to see in between helping the babies, I just, as a professional, from one professional to another, you are standing between a baby thriving and surviving, and basically hoping that baby just figures out how to compensate really well for the rest of their life. And to me, that's cruel, and it's malpractice, honestly. I can throw that out there.
Yeah, no, there are like so many things that you touched upon that I'm like, oh my God, we should talk about this. Oh wait, I want to talk about this. So I think to like streamline my thoughts in wanting to respond, I think first I want to just acknowledge that, like, obviously, and you know this, but obviously it's not just babies that are impacted by this. And I think that's a struggle that a lot of people have, including clearly that second, ENT that you saw, because the challenges that we see in infancy are usually just the start.
Right.
And we talk about it so often now, I think, and we see so many, I have a lot of philosophies on why we see so many, ties and struggles right now. But I do really believe that we are in a moment that allows for conversations like this to happen at a very loud volume, even if and even when there are many people who don't want to hear them.
Yeah.
We have social media, which certainly can be, let's be honest, a crapshoot, right? Like sometimes it's just really unhelpful.
Yeah.
But it also means that a mom like me in the middle of a global pandemic who's in quarantine with a newborn at 3 a.m. can find another mom's blog talking about how she and her baby 3.5 years ago experienced the same exact symptoms, right? Or through Instagram, we can find resources like you. And so I think that when we're talking about just like finding the path to go and coincide with our intuition, it can be really different for everybody. Finding the proper resources can be really challenging. And whether a child is a day old or 5 years old or 13, like, it can always be challenging. And I think that that is such an important thing to just acknowledge in general. You also noted and said in just a little while ago that Lily, yes, experience a different sensory things. So I kind of just want to touch upon that because so we learned a little late in his life that my nephew, who is now 4, has ties.
Wow.
And he was exhibiting some really interesting symptoms that I don't think most people know or realize are always or can be linked to ties. And that included some like food sensory struggles, some ADD, ADHD like symptoms. Mari, I suspected, actually was having some sensory struggles around, I sort of always suspected it, but really around like 7, 8 months, I was like, okay, yeah, she definitely is. Specifically, she would not allow for us to touch her hands or her feet. Immediately, she would just pull back. It was like an instant intuitive reflex that she would do.
I know.
And
yeah.
yeah, she was first always very, very tight. And I talk a lot about that in general with not only other parents that I'm trying to help, just support and walk through the process with, but also just in the on my platform in general, I talk a lot about tension. And what is so interesting about this, and I want to note it and share. So we actually have had 2 separate release journeys with Mari so far in her life. The first was when she was 10 weeks old, and we addressed her posterior tongue tie and her upper lip tie. We knew again at the time that she had some upper buccal ties, but her tongue tie and lip ties were so severe that we just knew that that was really the root of almost everything she was experiencing. Similar to Lily, within about a day or 2 after her tongue tie release at 10 weeks, Mari's constipation went away.
Isn't that magical?
Yep, imagine that. Her colic stopped.
Yep.
Stopped. Her explosive, Mari would go through bouts of extreme constipation and then an extreme blowout. All of that stopped. And my husband and I used to laugh at how loud she would pass gas. We would be on the opposite end of the house and hear it, and that all stopped magically. But I want to fast forward to her second round of releases that occurred when she was 14 months old. We had to address her upper lip tie again. And we also realized at that time that her buccal ties were actually causing some serious struggles for her. Her upper teeth were coming in, and her molars that were just behind her buccal ties were pushing through. We knew that she was teething, but we didn't see them. And she was a cranky little beast for like 2.5 straight weeks. And it was so clear that she was cranky because she was just in pain. And it didn't really make sense to us that this was the process that she was experiencing, because normally, they're teething, they pop a tooth, it's within a couple of days and it's fine. This was not the case for her molars coming in. And so we learned that not only did it seem like the excessive tissue that was her buccal ties were actually potentially causing her molars to not be able to come through, but also that it was causing her tension.
Mhm. Yeah.
So we addressed her buckles and her upper lip tie when she was 14 months old. Immediately, immediately, Mari went from never wanting us to even wash or touch her hands in the bath or at a sink to her quite literally pushing her feet out for me to lotion them every single night and massage them.
It's amazing what happens when we take a child out of fight or flight and put them into what we call rest and
Yep,
digest. Like when you
yep.
allow the nervous system to function properly,
Mhm,
it's amazing what kind of a
mhm,
child presents to you. And that's,
mhm,
I'll let you continue, but like with Lily, a lot of hers presented in she didn't like tags. She didn't like seams. They weren't
mhm,
things that were like so disruptive that we, couldn't go about our normal day. She doesn't like, she'll get messy, but she wasn't a kid who loved to get messy. Like she would, play with Play-Doh, but then it was like, I don't really like it, so I'm not going to continue doing it. Or she would try a food and be like, well, I like it, but I don't really want to eat it, which was like very interesting. Or she just wouldn't try it. And she did, as an infant, eat a lot of foods until like about 15 months, and then just started cutting things out. And
mhm,
we also had an interesting experience with her getting sick from having like 5 vaccines in one day. And I think that changed like the profile of how she tasted foods as well. But I think there was always this underlying sensory component that I think got majorly triggered at that point too. And
mhm,
when she had her release, it mildly improved, but it was still a struggle but once she had the expansion and like along with that release that we did everything that started to do the myo, that's where like, I think the seams that sensory response to the hands, the feet, the tags, like that died down a little bit more in toddlerhood following release. And the foods, like, she would eat a certain variety. I always joked if it didn't have cheese or like bread, she probably wouldn't eat it. I mean, that was kind of like her
mhm,
MO. But holy cow, let me tell you now, like she, as a 6-year-old who is now post release, post expansion, back in some myo just to fix her like frontal lisp at this point. Like her oral rest posture is generally good. It's like more the swallow and frontal lisp quality that we're addressing. The girl, like she is just eating she had corned beef last weekend. Before that, she tried prosciutto. I was like, who are you? And what did you do with my child? And she loves salt.
mhm,
So no wonder she likes deli meats, but loves bacon, but will not eat chicken, will not eat like, she'll eat fish sticks now. And she's slowly like, my mom made, like my mom made like homemade chicken tenders and she will eat them. Whereas she would not have
mhm,
touched a 10-foot pole before. And just to see the evolution and how quickly it's happening now that she's had all the pieces of the puzzle put into place for her is like, holy cow, even I as a therapist who would throw these kids into feeding therapy without looking at the root cause, like without figuring out why they present this way. And sure, we worked with OT to address cranial nerves and, other, integration of, the systems and the nerves and all the things. Like we thought we were looking at it from that perspective, but really even our therapy to a certain degree was slapping a Band-Aid on a much larger issue. And it wasn't
mhm,
until I fell into the world of TOTs and myo that I fully had an appreciation for, oh my gosh, like these kids that end up in therapy for life for a speech disorder, like
mhm,
teenagers that come to me and that I have a tongue tie release and graduate in 6 months after having 7 SLPs and 12 years of therapy. What? These
mhm,
adults who are fatigued because they're realtors and they're tired after a 130-minute phone call and they have a tongue tie release and they no longer experience that fatigue and then realize that so many other aspects of their life were actually impacted that they had no idea were impacted until they then
mhm,
experience a different quality of life. So I mean, and those are more mild cases, like we have some more severe
mhm,
examples too. It's just like you said, it snowballs, right? But to see it all evolve from these little minor, what we seem like as like little minor sensory issues of these kids. And if a child presents with sensory issues, if a child presents like ADHD like qualities, like you mentioned, if a child presents like they have trouble with attention, focus, they're impulsive, they're picky eaters, they're messy eaters, they're cutting foods out, we need to be looking in their mouth. I mean, and the list goes, they have speech issues, they have delays. We need to be looking in their mouth. We need to be looking under their tongue. We need to be checking their cheeks. We need to be checking their upper and their lower lip, because there are 7 places that we could potentially have oral ties. And then what I learned, that which was really interesting, from Ron Ruska, who is, he's behind Postural Restoration Institute, PRI. A lot of PTs can go and get trained through PRI. He offers courses for other professionals too. He was like, we have ties throughout our body. It's not just in our mouth. And I was like, oh, okay. I mean, I was like, I've always said we're literally connected from the tip of our tongue down to the tip of our toes, like from a fascia standpoint. And when you start to think about it, and then you start to think about how, if we are truly tethered, and maybe this little tether in our mouth then pulls other things up and forward, or gets creates tension throughout the body, it's no wonder it's putting pressure on nerves. It all starts to make sense if you understand science. If you start to read about anatomy and physiology, you kind of start to go like, oh, why is nobody talking about this? And why are we kids through so much therapy and I know this will piss off other practitioners, but like, why are we putting them through therapies without looking for that root cause? So I'm going to turn it back to you so you can talk more about like the sensory stuff that we were talking about. But it's like, it just sends me on these tangents because it just makes so much sense. And we don't need 5,000 research studies to prove these concepts. No, anatomy and physiology, that is the science behind what happens if you understand normal, we can understand deviation from normal. And then we can understand what we're working towards getting back to, so that people can properly function and thrive in life. Okay, and drop mic.
I think never end rants. In general, don't. Yeah, I mean, I think, oh wow, there's, I mean, really so many things to say. I think I may want to actually share with you and anybody who would be listening 2 stories from adults that have been shared with me that really changed sort of my understanding of long-term impacts of ties and how often things are missed. So I spoke with a mom who shared with me that her son had not really had, to her knowledge, feeding issues ever, that his issues really and struggles were really around not even speech, but that he had always I believe it was his right foot always turned inwards. And he had been to physical therapist after physical therapist after physical therapist since the time he was a year old. He was then, when we spoke, he was 7. He had been to therapist after therapist, and consistently what would happen is he would go to a new therapist, they would work with him, they would see progress, and within a week after that progress was made, his foot would turn back in. And so as parents, like his parents and even, pediatrician, they were experiencing frustration. Why can't physical therapists figure this out? Why can't they, work their magic in a way that fixes the problem? Why do we always have to take him? Why are we, constantly spending money? So they would stop going, and then it would get worse, and they'd find a new physical therapist. And I don't recall who diagnosed him with a tongue tie. I don't remember what the scenario was, but at some point in their journey, when he was 7 years old, somebody connected the fact that he had a tongue tie with this struggle that he was having with his foot. And his mom shared with me that she was like, I honestly thought they were insane. I thought,
be connected to our toes.
Right. Why that how would that even remotely make sense? And yeah, right. But I guess they decided to like release his tongue, and the way that she described it, she's like, we didn't do it necessarily to fix his foot, but it was, thought that maybe that could be a benefit. And he shared that within a day, his foot no longer turned in. It had been like 6 months, and it has not been a problem since.
So we are literally connected from the tip of our tongue down to the tip of our toes. And I love
Down
that.
to the, yep,
That proves my
yep,
point.
yep.
Um,
Such an interesting, it was such an interesting learn for me in that moment to think like, first as a non-medical professional, to think essentially like, what, how and what?
yeah.
Like, I did not study anatomy and physiology. Like, I am a designer. Like, how I'm not in that world. So that was just like so mind-blowing to me, to think that there could even possibly be a connection. But the moment that she shared it, and I started researching about, the fascia and how your system is really all connected, I, as a non-medical professional, was like, that makes so much sense. That makes so much sense.
Can't provide.
So, so for me as a non-medical professional to see and acknowledge like, oh, that actually does make sense. That in my mind leaves no excuse for any medical or health professional to not be able to make that connection. So there's that. There's that. I just said it. Another scenario that I actually learned about was a woman in a local moms group. She's in her 40s now. And at some point, I was on social media because, during a pandemic, that's where most of my life has been. But there was a group of moms just talking about speech struggles. And of course, like, now that I'm within this, sort of TOTs sphere, if you will, my ears immediately, they're like, what speech issues? What's happening? Huh? What? Um, and so I'm reading through these comments, and this mom who's now in her 40s shared that she actually had a severe tongue tie. And what she shared was shocking to me. And she said that growing up, she did not understand why people talked. She didn't understand why anyone would want to speak, because it hurt. She was mute until she was 6 years old. She never said a word until she was 6. It was discovered, she had been through a lot of different therapies, and it was discovered at some point, somehow, those magical unicorns existed in her area, and she found somebody who said she has a tongue tie.
And she probably
It was,
mute. Like they probably gave her a diagnosis of selective mutism, which makes me go back to
yes, exactly.
the child's mouth that I've ever seen that occur to. Because what
Yep.
I worked with, I know early on, that had that diagnosis had a tongue tie and a lip tie, had a myofunctional disorder and needed expansion, went into an alpha appliance. And I'm sitting here going like, duh, why didn't I make that connection?
Yep. Yeah, she was diagnosed with selective mutism, and so what she shared, and she was basically like encouraging this mom to go forward with speech therapy, but to make sure she's finding the right resources. And so she shared that, at some point when she was 6 years old, it was discovered she had a tongue tie. They addressed the tongue tie. And she said that she remembers being done with the procedure and looking up at her mom and saying, "Mom, I can talk." Full sentence,
Yeah. Wow.
let alone a single word.
Right.
Like she said a full sentence, and she remembers her mom just crying.
Yeah.
And,
Wow.
I think that what's so challenging for me in this realm is understanding the really significant impact
Mhm.
these struggles have on health and comfort.
Yes. Yeah.
And for any medical or health professional to dismiss them. I thoroughly believe is negligent.
I agree. I agree 100%. Yeah. Yeah. And I think we all need to do better. I mean, I know we've spent a lot of time talking about like Mari's experience, your experience, Lily's experience, I had a tongue tie, these other stories that we've shared. And I think what it goes to show is if there is this much of an impact, like you said, it is completely negligent at this point to be dismissive or just completely ignore the problem. It's one thing if you haven't been trained. It's another thing if you have been, or somebody comes to you and says, I think this is going on, and you dismiss it, regardless of your level of education. As a provider, you have signed something that says, I will do no harm. You have a due diligence to that patient to go and research it. And if you're not willing to, then refer them to somebody else specializes in this and who can help either rule in or rule out that diagnosis. And that's all I will die on. And like, I think we can even wrap up on this note, because it is complete negligence if you are choosing, that is a choice. If you are choosing to believe old beliefs and you are not connecting them with the specialist that they deserve and need to thrive, that is negligent. Period. End of story. Yeah. So on that note, thank you. Thank you for your time today. Thank you for sharing your story and your experiences. And I know everybody can follow you on Instagram at the Unbound Network. That, what you're doing, to me, doesn't matter that you're not a professional in this space. Like, you are taking your story, your experience, you're sharing it so that other moms have a safe place and a knowledgeable space to connect. And, I love seeing information out there, one that's accurate, because you have a lot of accurate information on your account. But two, it's like personal experience that other moms can relate to. They know they're not alone. It gives them information that they can then go to Google Scholar or just Google in general and research further. And then they are empowered to take this information and questions back to providers and get answers for their children. We should not have to fight this hard as parents. But unfortunately, that is where we are still living in. And that's why I always encourage people to DM me, and I will do my dang best to connect you with a provider I know who is airway taught myocentric. Because that's, if we can start you on the right path, to me, you're going to get what you need if you connect with at least one right person in your area. So anyways, thank you. Thank you for your time.
Thank you.
Sharing your story.
Thanks for having me.
Yeah. And I will see you on the gram.
Yes, you will. Thank you.
Thanks for listening to this podcast. If you want to hear more of these Myo, TOTs, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.